Good day. I'm here to tackle about supervision. As far as we know, supervision is an important component of nurses and in professional development, and it supports us to ensure quality patient services. Supervision has benefits and outcomes for the individual nurse, patient, and employer. So, what are the functions of a supervisor? A supervisor should be a key man in management. As a supervisor, he or she makes decisions, control work, and interprets policy of the management to coworkers. He or she should ensure that the work is done. Next, a supervisor acts as a middle person. A supervisor has to work between two forces. Of course, the management and the workers. The management has a lot of product oriented expectation from him or her, and on the other hand, workers have a lot of reward oriented expectations from him or her as well. A supervisor is a planner and an organizer. Supervisors plan the daily schedule of the workers by guiding them on the nature of their work and divides them according to workers' interests and skills. A supervisor provides working condition. Supervisor's responsibility is to provide healthy and hygienic condition to its coworkers. He or she should act as a motivator by providing different ways of giving incentives to perform better. A supervisor is controlling. Supervisors record the actual performance, progress of work, and finding out deviations and making solutions. If they do not resolve the problem on their level, he or she needs to report it to the one on top of him or her. They enforce discipline. Of course, a supervisor is a leader and a guide and provide guidance. Supervisor acts as a leader. He or she should take the lead and influence others to do their best. He or she provides instructions and guidelines in order to achieve goals. What are the roles and responsibilities of a supervisor? As a supervisor, you should help your coworkers to develop their innate abilities and qualities in order for them to improve their performance. A supervisor must help subordinates in adjusting to their job and new environment. A supervisor encourages coworkers to be loyal to their organization. He or she is responsible for administration and policy adherence. A nurse supervisor manages registered nurses on their team. They may interact with patients, but they are mainly in charge of making sure that the entire operation is smooth and everything is in accordance to what is asked to be done. If something goes wrong, the nurse supervisor is responsible for taking action. A nurse as a supervisor, they need to make sure their team is properly trained and working in accordance to what is expected to them. Nurse supervisors must be able to work efficiently and quickly under pressure. They should know how to keep patients and staff calm and under control. They must also be able to deal with difficult situations, handling blood and other body fluids, and comforting people in pain. As a nurse supervisor, he or she should be a good communicator, for at times they have to talk to family members and deal with concerns and complaints. They maintain nursing guidelines by writing and updating policies and procedures. They assure quality of care by developing and interpreting hospital and nursing divisions policies and standards of care. They enforce adherence to State Board of Nursing and State Nurse Practice Act requirements and to other governing agency regulations, measuring health outcomes, against standards and making or recommending adjustments. They complete patient care requirements by scheduling and assigning nursing and staff, following up on work results. They establish a compassionate environment by providing emotional, psychological, and spiritual support to patients, friends, and families. They help promote patients' independence by establishing patient care goals, teaching and counseling patient, friends, and family, and reinforcing their understanding of disease, medication, and self care skills. They provide information to patients and healthcare team by answering questions and requests. They resolve patients' needs by utilizing multidisciplinary team strategies. They maintain safe and clean working environment by designing and implementing procedures, rules and regulations, calling for assistance from other healthcare professionals. They protect patients and employees by developing and interpreting infection control policies and protocols, enforcing medication administration, storage procedure, and controlled substance regulations. What is the difference between a supervisor and a manager? Manager. Manager is the one who manages people. They are the one who controls and organizes things and people, while a supervisor are the one who gives instructions regarding work and performance. They're also known as coordinator, facilitator, team leader, and overseer. Principles of supervision. First, supervision should encourage self-expression in order to draw out potential abilities. Second, supervision should provide initiative in order to take more responsibility. Supervision should provide full opportunity to do work in cooperation to develop team spirit and good interpersonal relationship. Supervision should give autonomy, depending from one's personality, competence, and characteristics. Supervision interprets policies and give creative instructions. Supervision should meet one's individual needs. In supervision, one should act as a leader in order to give guidance and encouragement. Supervision should be democratic. Supervision should be well planned. And good supervision respects the personality of an individual. What are the types of supervision? We have indirect, direct, autocratic, laissez-faire, democratic, and bureaucratic. What is indirect supervision? Indirect supervision is characterized by some form of authority over the work of employees not under direct supervision, of course. In other words, the supervisor is the one who provides indirect supervision and responsible for the work, but not the worker itself. Direct supervision. Direct supervision is used to refer to situations in which a supervisor is present at all times. The supervisor oversees activities of the one who is doing the work as they occur and provides constant direction, feedback, and assistance. Autocratic or authoritarian. It is a leadership style in which the individual have a control over all the decisions and little input from group members. Autocratic leaders make choices based on their ideas and judgment and rarely accept advice from followers. Under this type, the supervisor wields absolute power and wants complete obedience from his subordinates. He wants that everything is done strictly according to his instructions, and he or she never likes any intervention or opinion from others. This type is resorted to tackle indisciplined subordinates. Characteristics of autocratic. The leader tells and enforces. Little feedback is sought or needed from the team. Decision and process, task, goals are all created by the leader. No real sense of empowerment. Morale can suffer in the long term. And it is just getting the job done. When to use autocratic? When a task is urgent and needs to be completed quickly, with little time for thought and planning. Use this style when skills are in short supply and people need it to be guided through task with clarity and structure. Where there is no or little margin of error, and when conditions are dangerous. Rigid rules can keep people out of harm's way. Next, laissez-faire or free rein. It is known as independent supervision and delegative. The supervisor never interferes with work of the subordinates. There is full freedom given to workers to do their jobs. Subordinates are encouraged to solve their problem by themselves. So in this type, it is let them do. That's what they call it. So the characteristics of laissez-faire, there is very little guidance from leaders. Complete freedom for followers to make decisions. Leaders provide the tools and resources needed. Group members are expected to solve problems on their own. Power is handed over to followers, yet leaders still take responsibility for the group's decision and actions. Next is democratic. What is democratic? In democratic, the supervisor acts according to mutual consent and discussion, or in other words, he consults subordinates in process of decision making. This is also known as consultative supervision. Subordinates are encouraged to give suggestions, take initiative, and exercise free judgment. This results in job satisfaction and improved morale of employees. It is very open and collegial style. The democratic leader must also able to communicate that decision back to the group to bring unity. The plan is chosen. When to use democratic? Democratic style can bring the best out of an experienced and professional team. It capitalizes on their skills and talents by letting them share their views rather than simply expecting them to conform. It is used if the decision is broad and very complex. Next, bureaucratic. Under this type of supervision, rules and regulations are being laid down by the supervisor, and all the subordinates are required to follow these rules and regulations strictly. A serious note of the violation of these rules and regulation is taken by the supervisor. This brings stability and uniformity in the organization. Bureaucratic supervision rely on rules and regulations and clearly defined positions with organizations. People on bureaucratic supervision are likely to report only to their immediate supervisor. Employees in bureaucratic supervision are promoted based on their ability to conform to rules. Bureaucratic supervision is based on strict hierarchies and often depends on written job description and organizational charts. So, what are the types of supervision? We've got 3. So, educational supervision, it means like you need to assess skills, evaluate the needs and provision of learning experience, or you need to upgrade knowledge and skills. Next is administrative supervision, which wherein you monitor work and workload. You assure that the work is completed. Quality and quantity control, appropriate implementation of policies and procedures. And next is supportive supervision, which wherein you provide support, understanding, assistance, and understanding emotional needs. The supervisor gives supervisee a supportive environment which wherein they can enjoy high morale and job satisfaction. So what are the models of supervision? We've got developmental models, social role model, system model, and integrative model. First, developmental model. This model advocates that supervisor match the structure and style of supervision to the clinician's level of development. As the supervisee grows and develops the supervisory model, they are adjusted to fit the skill level and confidence of the supervisee. According to Stoltenberg and Delworth, 1987, there are 8 growth areas for each supervisee. So what are those 8 areas? It is intervention, skills competence, assessment techniques, interpersonal assessment, client conceptualization, individual differences, theoretical orientation, treatment goals and plans, and professional ethics. So it helps supervisees identify their own strengths and growth areas, enables them to be responsible for their lifelong development. So with the social role model, this model specifies that the supervisor act and perform certain roles, tasks, and functions that take into account behaviors, beliefs, and attitudes that the supervisee expected to follow. With system model, this model emphasizes a learning alliance between the supervisor and supervisee. This alliance is based on the relationship that is developed between the supervisor and the supervisee. And lastly, integrative model. This model is a mixture of all other models. It includes the supervisor's own style, demeanor, philosophy of effective supervision. Do you guys have any questions, I am okay and willing to take your questions and answer them. So, yeah. I want to share to you Proctor's model of supervision. So, according to Proctor's model of supervision, we this Proctor's model of supervision is commonly used in the healthcare. So, as far as we know, supervision towards reflective practice is the framework of Proctor, which wherein it focuses on 3 areas of supervision. One is normative. Normative in terms of managerial aspects of practice and learning. It is more on management, safety and assurance, such as observation of care, formal evaluation, meetings, CPD, and core mandatory training. Next is formative. Formative is educative aspect of developing knowledge and skills in professional development and use self-reflection for self-awareness development. The aim is to become increasingly reflective upon practice within the supervision process. And lastly, restorative, which is supportive and assistance with coping aspect for personal development, such as improving stress management and burnout prevention. Examples of these are like case conferences and group supervision. That's all. Thank you very much.